cycle, and good afternoon, Reen. Good to see you as always. I hope you and the community are doing well and we're able to enjoy some much needed rest over this past long weekend. As always, yama to you and CKON for providing time for me to provide an update to you and the community. As mentioned, for today's discussion, I'll be providing an update on the COVID-19 vaccine rollout and speaking about the current restrictions. To date, a total of 1,978 doses of COVID-19 vaccines have been administered by the MCA Department of Health. This total includes both Moderna and Pfizer vaccines, as well as both first and second doses. And we know that many more have received vaccines through the services provided by the St. Regis Mohawk tribe. The latest figures that we received from our Department of Health indicates that 4,005 people have received total doses have been administered to Akwesasne. This includes both first and second shots administered by the MCA and the St. Regis Mohawk tribe. We are so grateful for many of the community members throughout all of Akwesasne that have chosen to receive their vaccine, because this is the best way to stop the spread into our community. However, as always, it's super important that we continue to be vaccinated and encourage members to get vaccinated as well in an effort for us to reach herded community immunity. Again, this happens when a population becomes immune through immunization or through previous infection. And obviously, we prefer that our community members take immunity through vaccine rather than infection. And it's been reported that 70 to 90% of the population is needed to be vaccinated for the herded immunity to be effective. It's difficult to determine the accurate percentage of all Akwesasne who have been vaccinated so far. This is because the MCA reports a total population of approximately 12,000. The St. Regis Mohawk tribe reports a total population of about 11,000. As a community, we know that there are Akwesasne who are included in both. The MCA reports approximately 9,800 Akwesasne who are over the age of 18. If we use only MCA's total adult population of approximately 9,800, that means we would need 6,860 people to be fully vaccinated to meet the 70% threshold, and 8,820 people to be fully vaccinated to meet the 90% threshold. Given that MCA has administered only 1,978 doses, and the St. Regis Mohawk tribe has administered 2,027 doses, that brings our community total to 4,005. We still have a ways to go to get to the community goal of reaching herded immunity. I encourage every community member to get their COVID-19 vaccine. MCA continues to work hard to ensure that all community members who want to be vaccinated will be vaccinated. The MCA Department of Health continues to take appointments to receive, for you to receive your vaccine. Simply call our community health program to book an appointment. Also, please keep an eye out for upcoming MCA walk-in vaccine clinics. The St. Regis Mohawk tribe continues to offer walk-in clinics every Wednesday at the former IGA building as well. The more people that get fully vaccinated, the easier and quicker it will be for the restrictions to continue to be lifted. Remember that it takes 42 days from the date of your first dose of vaccine to reach the 95% vaccine effectiveness. Once the initial vaccine injection is given, it's followed by a second injection that is given 28 days later. It's important that you receive the first dose followed by the scheduled second dose in order to reach the 95%. This happens 2 weeks after you receive your second shot. By following the schedule for vaccination, the 95% effectiveness is reached within 42 days of the first dose, since the first dose was received. This is when you're considered fully vaccinated. It's important for everyone to understand that even after you've been fully vaccinated, we must still continue to wash our hands frequently, wear a mask, and maintain the 2-meter distance from others. As for the restrictions within the northern portion of Akwesasne, the community curfew still is in effect right now from 11 p.m. to 5 a.m. and the 100-mile, 160-kilometer travel radius also remains in effect. Anyone arriving from outside of Akwesasne who's traveled for non-essential reasons must quarantine for the 14 days. These restrictions have been in place for some time now and are intended to keep our community and our community members safe. While discussions take place at least on a weekly basis regarding the status of our community restrictions, no decisions have been made at this time to lift, change, or amend any of these restrictions. Since my last update, there has been a number of changes made in Ontario regarding the restrictions. The province-wide stay-at-home order has been in effect since April 8th, set to expire on June 2nd. This stay-at-home order allows travel outside your home for essential purposes such as work, groceries, exercise, and it was put in place due to the rise of COVID-19 cases in the province, which were primarily caused by the variants of concern, or VOCs. And the hope was that the rate of infection would drop and that at least 40% of all Ontarians would have received their vaccine, and the dire situation that Ontario hospitals were facing will have improved. On Thursday, May 20th, Ontario released its roadmap to reopening, which was a 3-step plan to safely and cautiously reopen the province and gradually lift public health measures based on a province-wide vaccination rate and improvements in key areas in public health and healthcare indicators. As a result of the stay-at-home order, these indicators have since improved. Ontario has decided to allow for more outdoor recreational amenities to reopen as of Saturday, May 22nd. Each of the 3 phases set out in the reopening plan will remain in place for at least 21 days to allow for proper evaluation before proceeding to the next step. The percentage of adult vaccinated with 1 dose must also keep increasing in order to advance to the next step. In order to progress to step 2, 60% of adults in Ontario must receive at least their first dose. In order to go to step 3, 70% of adults in Ontario must be vaccinated with 1 dose and 20% must be vaccinated with their second dose. And beyond step 3 is the 70-80% of adults in Ontario must be vaccinated with 1 dose and 25% must be vaccinated with their second dose. This plan was released on May 20th. As long as the current trends in health indicators continues, including the province vaccination rate, Ontario expects that step 1 will begin in the week of June 14th. The plan was released so that people know what to expect in the coming weeks. It's important that everyone continues to follow the public health advice and get vaccinated in the meantime. It should be known that the current case counts, the ICU capacity, and hospitalization is decreasing, but it is still concerning overall. This is why the plan allows for a gradual lifting of restrictions to implement the reopening cautiously. The restrictions on interprovincial between Ontario and Quebec continue to remain until at least June 2nd. The Cornwall Community Hospital announced on May 20th that they will begin the gradual resumption of some non-emergency, non-urgent day surgeries and procedures. A pause on these services had been put in place by the province on April 20th to ensure that hospitals could accommodate the increased number of patients requiring hospitalization due to COVID-19 at that time. Cornwall Community Hospital estimates that over 2,000 patients are currently waiting for an elective procedure at the hospital, and the hospital hopes to catch up in the coming months. Our local hospital continues to operate at near capacity levels, and the resumption of services will be gradual and can only continue if the case numbers continue to trend downward. I am sure everyone has heard of the variants of concern that are out there. These are variants that are part of the original COVID-19 variants but have mutated. There are now 4 variants present in Ontario. The VOCs, also variants of concern, are named based on where they were first identified. The VOCs present in Ontario include the United Kingdom's or UK, South Africa, Brazil, and India variant. The South African variant has been found in our community as well. These VOCs spread faster, causing greater severiness of the disease and raises concerns about the effectiveness of the vaccines. The existence of VOCs are another reason why everyone needs to get vaccinated and also to continue to follow the protocols, including washing your hands frequently, wearing a mask, and maintaining the distance. We must all continue to work hard to keep ourselves and our community safe. I understand that people everywhere are generally frustrated. We're frightened at times and fatigued because there's great reasons to be. However, we must still continue to follow the safety protocols that have been put in place until there's enough people vaccinated to lift the restrictions and discontinue the safety protocols. Reen, that's a quick snapshot update of where we're at here at the Mohawk Council. I'm open to taking questions from you or the community.
All right, thank you. Again, we're talking with Mohawk Council of Akwesasne, Grand Chief Abram Benedict. And if you have a question for the Grand Chief, you can phone it into the radio station, 518-358-3427, 613-575-2101. That's the only way you'll be able to get your question asked today. Even though this program is streaming live on MCA's Facebook page, you can't put your question in the comments. Please make sure that you call the radio station if you have any questions. So we have had a number of questions come through. So we're going to start off. I will do them in the order that they were taken, okay? So we will start off with our first question. Do you know anything about the house fire in Snai on Monday? And the question continues. Why does the SQ need to come into the territory when investigating situations?
I'm not, well, first off, I understand that everybody made it out safely, which I'm glad to hear. It's obviously devastating that the family has lost their home. So I'm really sorry to hear about that, but happy that everybody's safe. There would be, without going into specifics about this, but there would have to have been suspicion of a reason why the Mohawk police would have asked the SQ to come in to take a look to find out if there are criminal elements to the house fire, or if there's a suspicion that, you know, there was electrical, what have you. And they've asked for the SQ's expertise to help and identify the cause for this fire. I mean, it may not have been anything intentional. It could have been accidental, but then, you know, there's the family is owed an explanation as to what has happened, and it's likely not obvious that you know, a stove was left on or something was left on that caught fire that they know of. So they've asked for the SQ to come in and help offer expertise in investigating the cause of the fire.
Well, I know that a few weeks ago, maybe a month ago, the Akwesasne Mohawk police had announced that they were calling in the SQ for a firearms investigation. So would the Akwesasne Mohawk Police Service report to the community their findings, or do we have to wait until the full investigation is completed, even if that's months down the road?
Yeah, the Mohawk police notify the community when the SQ assistance has been requested, and in that case that you're referencing, it was for divers to come in and search for some possible firearms that were in the water. We won't be notified of the outcome, likely until if charges are laid and you know, the case proceeds like that, then there may be disclosure that in fact you know, a firearm was found in the water. So there are areas that the Mohawk police deem that they may need supports from the SQ to either investigate or dive, or in the case of the, you know, the unfortunate house fire, to better understand you know, what the cause was. They may ask for additional supports to be able to do that. Those are the situations when the SQ were asked to come in.
All right, another listener would like to know, can you list travel restrictions for both jurisdictions of our community?
Can we lift them?
No, can you list, make a list?
Oh.
Can you list the travel restrictions for both jurisdictions of our community?
Yeah. Well, I mean, we have struggled with public health directives as far as Canada and the United States go for since the beginning of the pandemic. You may recall that in the beginning, the masks weren't required in the city of Cornwall, but they were actually, well, in Ontario, but they were in New York, right? So, I mean, we have seen over the course of the pandemic a bit of back and forth on the directives that are in place. As of right now, the Mohawk tribe recently, I believe last week, lifted their travel restrictions. We have not at this point. I know there's a lot of people that have questions about this. We are continuing to revisit this every week. We have to remember as well that the Mohawk Council, which is receives our vaccines from Ontario and Canada, the vaccine rollout started a little bit slower for us. Members were the Mohawk tribe and members were able to go to the Mohawk tribe to get vaccinated, well in advance of a month, or if not a little bit more than we were rolling that out. And we were simply waiting for vaccines to come in from the government so that we could begin that rollout. So, there's no doubt that members under the jurisdiction of the tribe, more members under the jurisdiction of the tribe are vaccinated more than here in the northern portion, but we are working very hard to make sure that we get more rolled out. As I reported in the numbers, we have 4,005. That is with the numbers that we have given, as well as the numbers that the tribe has administered to members who live under our jurisdiction. So that is a relatively good number. I can say that, there are increasing pressures for the restrictions to be removed, but recognizing though, as well, Ontario still is in the stay-at-home order until at least, next week. Their three-phased approach is based on vaccination of the regions. So while people are anxious to be traveling, unfortunately, there's not a whole lot to be traveling to in Ontario. Quebec is a little bit different at this point. They've only just rescinded their curfew and other measures this week. In fact, it's just this week. So we are actively reviewing this, and I anticipate that based on the number of vaccines that we have given, based on the recommendation from our MCI Health Department, that these restrictions will be laxed in the very near future.
All right, another question. Do you find some of these restrictions unfair? For example, a community member working in the southern portion of Akwesasne, but residing in the northern portion and having to self-isolate and lose wages because of MCA's policy.
Well, some of these decisions are administrative as well. I do know that, we have gone back and forth on the 14 days and what is required of staff. That is, administration has determined, which the 14 days and how that's administered. But, the difference again on the northern portion is that, there's lots of restrictions that still continue to be in places around us in the northern side. The southern side is relaxed quite a bit in the last little while. We're going to continue again to monitor the case numbers, monitor the number of vaccines being administered, and will make modifications necessary. Again, I anticipate in the very near future. These are not in place to, disrupt. These are not in place to be punitive. These are in place to protect the community and to ensure that, we're not getting an abundance of positive cases in the community. And, in the point where we're having a hard time doing contact tracing and adding to the numbers that are being reported in Ontario and in Quebec. And I'll say that, we've reported, and the Mohawk tribe has reported in the last week, a number of days with 0 cases, which is a good indicator. So, there's changes coming in the very near future.
All right. So another question regarding the travel radius. Why is it only for MCA employees? MCA employees must report if they've traveled outside the radius, and they're reprimanded if they have, and must use their own personal sick time for the 14-day isolation period. When will this change? A lot of MCA employees are now vaccinated. So I know that you covered a lot of that in the last question. I just have to make sure that I ask you the question that was phoned in by someone else as well.
Yeah, no, absolutely. Well, I can't speak to if any employee is reprimanded. Again, those are, through the administration and supervisors, etc. But because the 14-day quarantine and the travel restrictions is a community directive, and in fact is an interim law, the organization is required to follow that. I mean, the MCA as an administration can't determine, what's going to be enforced and what's not. But we have I understand that the administration has worked in different situations with staff to help mitigate some of this. I mean, if we're traveling, again, the directive is non-essential outside of the 160 kilometers. So if you're traveling down south for vacation or outside of that area that for not an essential reason, then there needs to be the planning needs to take place in relation to that. So again, I hope that we're able to remove some of these restrictions in the very near future, because we are seeing a good increase in the more people getting vaccinated. One of the challenges we face too, though, is that while the CDC sets kind of the national guidelines in the United States, in Canada, Health Canada and the provinces set standards as well, and we don't have a science table per se, or within the MCA or even within the tribe that can help make those recommendations. So we have to rely on external agencies, and the tribe would rely on the CDC, we rely on Health Canada. But one of the challenges we face here is that most non-Indigenous people are still on their first shots, right? So it's hard to expect the Health Canada's or the Eastern Ontario Health Units to give directives for second doses when they're still trying to get the first dose out into people. So this is an ongoing discrepancy between on-reserve and off-reserve communities across Ontario. And I've been in a number of discussions where communities are facing the same thing, where half the community the community has essentially achieved herded immunity, but the local non-Indigenous community next door is struggling at 60% of first doses, never mind the second doses. So this is something we're grappling with, and we'll continue to monitor and hopefully get some clear directives in the near future.
All right, is there an MCR that mandates these rules for MCA employees?
So again, the restrictions on travel and the 14 days is a interim community law. Therefore, the organization is required to follow the laws.
These requirements for MCA employees creates a deceptive and hostile work environment. How can you address it or fix it?
Well, I mean, we're all obviously under a lot of extreme stress and fatigue because of the pandemic that we've been dealing with for a very long time now, and we all want to be able to do some additional leisure things and see family and things like that. So, I mean, the administration of it within the organization is under the purview of administration and not council. Council has set these directives for the community and the organization at large. And, I would hope that they're not creating deceptives. I mean, again, the way it's written is if you're traveling outside of that for non-essential purposes. So if you have to travel, 200 kilometers to see a specialist or to receive a procedure, or, that is an essential reason. Traveling for vacation, you're just going to have to right now, continue to make additional accommodations for your travels. That's as of right now.
Okay. Why do the Siverages Mohawk Tribe and MCA EOCs, Emergency Operations Centers, no longer have a uniform approach to combating the COVID-19 pandemic? At the start of the pandemic, these community members feel they used to be in lockstep together.
Mm-hmm. There still is regular calls between the EOC of the MCA and the Siverages Mohawk Tribe. In fact, and MCA administration still continues to participate in those calls as well at various levels. What collaboration is happening there? We still continue to meet at the leadership level every 2 weeks with the Siverages Mohawk Tribe to rebase, touch base where things are at, discuss current current restrictions that are in place or directives that continue to affect the community as a whole. Again, as I mentioned earlier, we unfortunately our vaccine rollout was a little bit slower on the northern side, and we try to be in sync as much as possible, but in the case of the restrictions, we're not able to right now. But I anticipate that that will come back in line, and hopefully we'll continue to see the vaccines be administered continue to grow. The the positive tests continue to stay very low, and then we're able to make sure that we are again in the same arena of restrictions.
So could we, as the Mohawk Council of Akwesasne, which has jurisdiction on the northern portion of our community, could we, as Grand Chief and Council, can you make your own laws or make your own adjustments for our community outside of what the Eastern Ontario Health Unit is doing, like in following Ontario? Can you choose to follow Quebec instead, or can we choose to make our own COVID-19 restrictions?
So we used Eastern Ontario Health Unit as guidance as far as what some of the restrictions or implementations may be. And again, that goes back to, we don't have, the access to data, regional data around us. We don't have a science table. I mean, we have lots of people in our community that have experience in a wide variety, but we don't have, certain access to, certain medical personnel or people that just study this all the time. So we have to rely a bit on them more for some science directives or science insights. We have implemented some directives that are specifically to our community that that are not on the outside, specifically the travel radius. So while Ontario may be now on a stay-at-home order, they don't have a travel radius for their citizens that say they can't travel outside of a certain area. We have that. I mean, so that was instituted through a community interim community law, as well as the 14 days. So if you travel from Toronto to, say, North Bay, there's not a requirement for you to quarantine for 14 days when you get to North Bay or when you come back from North Bay, but there is in our community. So that's another community law that was put in place for the safeguard of our people. Now, I mean, again, we rely on them in certain areas, but there has been conversations happening because we are double vaccinated community, or a pretty good significant amount of people have been double vaccinated in this community. So we're unfortunately going to have some discrepancies on what can be done outside of our community and what can be done inside of our community. I can tell you that these conversations are happening actively right now, and that there continues to be regular briefings on modifications that can be done in the very near future.
Again, we're talking with Mohawk Council of Akwesasne Grand Chief Abram Benedict, and if you have a question for the Grand Chief, you have to call into the radio station at 518-358-3427, 613-575-2101. That's the only way to get your question asked to the Grand Chief. I will let you know we will go at the latest 1:15. That'll be the latest that we go. Another question, and again, a lot of these are mixed in with what you've already answered. When will MCA follow suit and join the Siverages Mohawk tribe in lifting that travel radius and other extreme measures the tribe has now lifted?
Well, I know it's obvious that this is on the top of many of community members' minds as to when this is going to be changing. I can tell you that we'll continue to monitor this. This will, we're actively looking at the information that's available to us, as I've articulated in my presentation about how many vaccines have been delivered so far, how many of, what a herded immunity looks like, what a benchmark looks like. So, we are actively trying to ensure that we have all of that information before we make decisions. I know that the province of Ontario has announced a 3-phase approach as well. But I think that, it's the United States that has a different approach that we're trying to balance in all of these decisions. And these, again, are being done so that, we continue to be safe. Remember that we were one of the first places in the region to have a variant. We were one of the first communities to have a positive case in their community. So, clearly we don't want to be the first one to be heading back into, a territory of having a high increases of cases because we reacted a bit too soon. So I also want to say too, and when we look at the CDC and Health Canada, this it is frustrating, and does boggle us that, when we look on the south side of our community, past Messina and nationally, the approach has been completely different than it has been in Canada. And, there's a lot of different factors that come into place as well. While in Canada, the legislation, they offer a lot of benefits to employees, meaning that, employers have to accommodate their employees for sick, benefits and things like that. In the United States, they don't, right? I mean, they have to apply for unemployment insurance, which doesn't last very long. There's been some more larger programs through Canada that have been available, as well as healthcare. Healthcare in Canada is a national program. Everybody has health coverage. In the United States, not everybody has health coverage. So there's a lot of factors that are a little bit different in the United States than there are in Canada. And, so people have went to work sick many of times in the United States as a whole than they have in Canada. And that's because they have no sick benefits, and, they can't afford to go to the hospital. So the approaches have been quite different. Now, where the United States has been able to catch up on is that they make their own vaccines. Unfortunately, Canada doesn't make their own vaccine. So once a vaccine was approved, they were able to roll out millions and millions of vaccines to the entire country. In Canada, they're relying on purchasing them and getting them into the country and then administering them down into the provinces. So the dynamics are a little bit different on each side. And this is one of the downfalls that we have to living on the border. There are obviously some benefits to living on the border, but this is one of the downfalls, is that the approaches are completely different. And, we have to manage all of that in order to manage our expectations, but also to keep our community safe.
Is there an MCA resolution concerning rules that are being imposed on MCA employees regarding COVID-19 and how they are being forced to use accrued vacation time instead of sick time?
Mm-hmm. Again, there is no resolution that says that, but because it's a community law, the MCA organization has to follow the laws.
What is the purpose of vaccinations if we still can't travel beyond the 100-mile radius for work? When 10 miles away, we don't have to do that.
Mm-hmm. Well, the purpose is to keep us all safe. Let's face it, there are still people in our community that are not vaccinated at this point. So we want to make sure that we're all keeping each other safe, that we're not transmitting it into the community, that our dudas are kept safe, and that's through vaccination. So, I understand that there's a lot of concerns and people want to travel. I can only say that we're continuing to actively review this, and that, likely decisions will be made in the very near future that relax some of these restrictions. Now, again, I must say that, the provinces around us still have heavy restrictions happening. The United States is different, obviously, but, these are all the factors that we have to consider in making these decisions and ensuring that, we're kept safe as a community as a whole.
We have a listener who's just tuning in. They would like to have that number of how many are vaccinated in the northern portion of Akwesasne only. Yeah,
so the Mohawk Council of Akwesasne has administered 1,978 doses of the vaccine. That's a combination of first and second. And then the tribe on our behalf, to our members, has administered 2,027 vaccines. So the total is around 4,005. Now that is based on the current information that I have. It's changing quite often. There may be, some, as they call, a margin of error in there, but that's the information that I have. So 4,005.
All right. Another listener would like to know, They use the term pass the buck, and they would like to know, why do you pass the buck to administration? Isn't council in charge of administration? And this listener feels perhaps we should interview the administrators and directors next time in lieu of the Grand Chief.
Well, there is a separation between political and administration here. The council only has one employee, and that is the executive director. Council sets the laws for the community, and in this case, we have established the 14-day and the travel radius. The administration cannot say that we're not going to apply that to the organization because it's a community law. So how it's applied is through administration. Now, you know, I mean, we can continue to be upset that people are losing some sick time over this. I think that, you know, based on all of the questions that we have heard this morning, there is a lot of, or sorry, this afternoon, there is a lot of concern around this, and we can have I'll have a conversation with administration on that, but ultimately it's going to come down to council, because administration is going to say council has said that community has to abide by the 160 kilometers and the 14 days. And I sure hope that, you know, the other 12 members of council who do the voting on the resolutions are listening today and hearing what the community's concerns are. I will bring it back and relay it, but also, you know, we're not going to make these decisions based on because somebody wants to head to Florida for a weekend. We're going to make these decisions based on making sure that we're well on our way to a herd immunity, and then our community continues to be safe.
Is MCA's plan to vaccinate community members who are allergic to PEGs, which is an ingredient in the Moderna and Pfizer vaccines?
Yeah, so the vaccines to anybody are not, they are optional. I mean, we want everybody to make an informed choice. Well, I've, you know, spent some time saying that we need to be vaccinated. Everybody needs to makes an informed decision on whether or not they're going to receive the vaccine. Now, for the MCA, when you sign up or call in for an appointment or go to one of the walk-in clinics when they're scheduled, they will ask you and go through a list. And one of the questions is are you allergic to certain ingredients or certain things that are in this vaccine? If you are, they won't administer it to you, but there are other vaccines that we can work with East Ontario Health Unit to get for you to be vaccinated. These sort of situations are a case-by-case basis that we can work to accommodate.
Can you please clarify what community law we're following regarding COVID-19? What community law is it if it's not an MCR?
Mm-hmm. Well, it's a community law that was accepted by MCR, but it doesn't say it's only for MCA employees. It says all members under the jurisdiction of the Mohawk Council of Akwesasne, and it's under the Akwesasne curfew law. That's the one that says that the curfew is established as this parameter, which is 11 p.m. right now to 5 a.m. and also says that any community member traveling outside of the 100 miles, 160 kilometers is required to quarantine. So it's a community law accepted by resolution.
And another question, are you running for Grand Chief again?
Well, I don't want to make these things, about me and where I'm going as a community leader, but I have been nominated, and we have until Thursday to accept nomination, and after that, the Chief Electoral Officer will make the list official, and people can take a look then. But I did, I don't want to, make this about me. It's about the community.
Stop signs in the village, how are those going?
Yeah, they, well, obviously, we have seen an increase in traffic here in Ganadago, and there has continued to be concerns at certain locations throughout the community over the years. We have instituted 2 new stop signs here. And so far, I think that the feedback from the community or the residents of Ganadago is positive. I mean, nobody wants to have unfortunate mishaps in the community, and stop signs is a tool to help slow the traffic down. And as everything that I have heard is that it's doing what it's supposed to do.
We understand that the Grand Chief and District Chief nominees have until 12 p.m. Thursday, May 27th to accept or decline their nomination. So keep that in mind for individuals that have been nominated for those positions, Grand Chief and District Chief nominees. You have until Thursday at 12 noon to accept or decline the nomination. Another question, what about the rocks in the water? There have been some rocks or boulders that have been discovered underneath the diving board. Will MCA be removing them?
I was just made aware of this at the same time, and the community was made aware of this as well, which is very unfortunate because I know that there's been a committed group of community members who has been working over the years to keep the point beautified, as well as improvements there, and then for some reason or other somebody has thrown some very large rocks in there. So I will loop back around with some of the district members of council to chat with them about what some of the options are, but I do know from some of the online chatter as well that people have been looking at that. So we'll be actively supporting or trying to find a way to make that safe again, that our residents can enjoy the point without the threat of hurting themselves.
How will the general election work under the restrictions for COVID-19?
So the actual election day, everybody will be screened coming in to make sure that they are safe. The social distancing will take place. I mean, if there is a large number of people have come in at the same time, they'll have to maintain the 2 meter, or sorry, the 2 meter distance from each other. But for this election, there is, we've always offered, or the electoral officer has always offered advance polling for community members, which is basically by appointment. That period of advance polling is I believe, at least the minimum of a week. It may be actually 2 weeks. I don't know offhand, but so community members who are concerned about having to go to the district center, wait in line, or maybe are not comfortable going to the district center because of COVID, can call the chief electoral officer, and they will book a time for in-home voting or at the DEO's office. So advanced polling has been extended for a longer period of time than what normally would have happened in the past, and that's simply to give more to space things out. So that is the accommodations that are happening, including the social distancing, masking, the plexiglass, things like that.
We'd also like to remind individuals to make sure that they check that their name is on the voters list for the correct district. That's your responsibility as someone who chooses to vote and participate in the MCA general election. Same thing goes for the tribe when they have their election on June 5th. That's your responsibility to make sure that you're on that voters list. Another question, will we need to get a booster for COVID-19 vaccine?
Yeah, so the after the second shot, then 2 weeks after your second shot, you're considered to be 95% protected. There has not been a determination from either Canada or United States science tables that say whether or not we'll have to get an annual shot or every year we'll have to get 2 shots. No announcement has been made on that. So as soon as that is, we will further investigate that, and we'll have to plan accordingly going forward.
All right, so I'm going to close the phone lines now. And like I said, the furthest we'll go is 1:15. And as of 12:58 p.m., I'm going to close the phone lines to questions. So we can get to the rest of these and wrap up by 1:15 p.m. at the latest. So listener wants to know, do we have specific vaccine clinics in the northern portion of the community? And if we do, why don't we hear about these vaccine clinics? I always hear about them after they've come and gone a few days. So
Mhm.
again, for vaccine clinics on the northern portion, and where is that information being presented to community members so they can go?
Yeah, so community members right now can call the MCA Health Department, Community Health, and make an appointment to receive a vaccine. There has not been a date officially announced as of today for a walk-in clinic, which we've had a number of them so far, but there will be some. I did check in this morning with the MCA Health Department, and they are working to schedule June walk-in clinic, so those will be announced. But anybody who wants to receive it is asked to call the health department, make an appointment. They'll let you know when those clinics are and what time they'll be expecting.
All right, another question, a bit of clarification. It says MCA employees are forced to use their vacation time, not sick time, for self-isolation, or do you not know this?
Well, those decisions, again, are not made by the Grand Chief. They're made by the administration of the MCA, but I may have misspoke to say that they're required to use sick time or vacation time, what have you. We'll have to continue to monitor this going forward. If the restrictions change, those requirements will change as well once either the radius expands or or is lifted altogether. And that the requirement for isolation or quarantine could change as well. So my apologies, I may have misspoken, but again, I don't head up the administration of the MCA.
All right, what percentage of the northern portion population is vaccinated? This is someone who's just tuning in as well, Grand Chief. What percentage of the northern portion population is vaccinated? And what percentage do we need for herd immunity?
Yeah, so the numbers that we reported, I didn't report exactly the number of the population. I'll tell you that this has been a bit of a challenging, and I think I had mentioned that in my formal presentation. It's a bit of challenging to know exactly our number of residents in our community. We don't, we have what they call is the registration list. So we have about 12,500 people who are on the registration for the MCA. We don't exactly know how many people reside in each district. We have approximate numbers to go by. So if we took the 12,000 people that are registered with the Mohawk Council, there's 9,800 of them are over the age of 18. So that's people who have a status card registered with the Mohawk Council of Akwesasne. 9,800 of them are over the age of 18. So if we use 9,800, in order to receive 70%, we need 6,860 of those people to have received their second vaccine to be herd immunity. That's 70%. 90% is 8,820. At this point, a combination of first and second, we have administered 4,005 vaccines within the community under the jurisdiction of the Mohawk Council. And that was done some through the MCA Health and some through the St. Mohawk Tribe Services.
All right, another question. Will MCA consider online voting because of the risks of COVID-19?
So those who are concerned about that are asked to call the electoral officer, make an appointment for advance voting if they're concerned about the risks of in-person. Of course, the in-person will have all of the health protocols in place to protect you and the DEOs and the CEO. Will online voting happen? No, unfortunately not. So the way the election is administered, it's administered under the Akwesasne election law, and the Akwesasne election law currently does not allow for online voting. It is something that's been talked about, but it would require the law to be changed, and it's not possible to change the law a month before the vote.
And another caller wants to thank Chief and Council for their work, but who gave the executive director permission to sign the political service contract on behalf of the community.
It's not uncommon for the chiefs or grand chief to enter into an agreement with the organization, which simply outlines what those administrative working requirements are, and essentially is a vehicle to compensate the chief and the district, the grand chief and the district chief. So since I've been, a member of council, there's always been an agreement signed between the organization and the member of council. So it's not something that is new. It's just that, it's an administrative document that the organization requires for the members of council.
Okay, so those are all of the questions that I have received, and I'd like to thank our CKON staff for taking care of the phone lines during today's program, as they do each time the Grand Chief comes on. So Grand Chief, I'm going to throw it back to you. You have closing comments, please.
Yeah, no, absolutely. Thank you, Reen, as always, and thank you to the staff as well who are manning the phone lines that are taking the questions from the community. And it's obvious that we are all anxious to be able to travel a bit further than the 160 kilometers or 100 miles based on today's questions. Again, as I mentioned earlier, I will take this back to council and have a conversation with them. Ultimately, it is up to council to determine what restrictions remain and which ones are relaxed or which ones are removed, because it is instituted by a resolution of council through the interim law. So that is the process that will have to take place. Again, these are not been designed to be punitive to the community. It's based on the numbers that are around us, based on the caseloads as well of the positive cases, and now a measure that's being considered is the number of vaccines that have been administered. And as reported, between the first and second dose, we have about approximately 4,000 people that have at least received one or possibly two of the vaccines. So we're going to continue to examine that, and it is, the safety of the community is at the top of our minds on this matter. So, this global pandemic continues to be trying for all of us, and we're very fortunate that we're in the position where we're at, that we have vaccines that are rolling out quite steadily. We have people that are getting their second vaccine. It's not the same for every community in Canada or in the United States, in fact. But we're quite lucky here as well. But we're not there yet. We're getting close, and we just have to continue to exercise patience and take it one day at a time. Support each other along the way. This has been a very long road. When this was declared a global pandemic last year, we never thought that we would be talking about this a year and 3 months later. And we still have a ways to go as a community. But we have done well, and we need to continue to support one another on that. So with that, Reen, again, thank you as always. I really enjoy coming out here. I know some people have, are saying, well, you're passing the buck, but I'm here to listen. I'm here to deliver the message, and I'm here to help guide our community in the direction and keep us all safe. And and ensuring that we're making the decisions that are protecting our community, and we're not, going too fast. And so as always, Yamagoa to you, Yamagoa to our listeners, and hopefully, we'll touch base in about a month or so. So Yamagoa Ring Cook and Yamagoa Akwesasne.